So this ECG has been presented to you by one of the FY1s. Of course, you are ST2 in your GP training. You tried to get some information from her, but she's just her first week into FY1. She's just straight from medical school. She can't tell you much, but she was hoping you'll be able to take control. So what sort of ECG is this? What's happening to this patient? 56-year-old male.
Is this William Marrow sign?
So you need to tell me what you're seeing, and then we can fish out the diagnosis. So what's jumping out at you?
Just looking at the reading strip, the
reading. Yes, good.
These two.
That's always good to look at the reading strip. Yeah.
And just looking a little bit bizarre, but those stroke of like looks like the left bundle branch block to me.
Okay. Anybody else seeing anything different?
Hyperkalemia.
No, first there's no T wave. There's no T wave. This is just a ventricular rhythm, maybe ventricular tachycardia or a ventricular tachycardia, maybe.
Okay.
Yeah, I'll go.
Yeah, I think it's I think it's more of hyperkalemia because of this, like V1 and V4. V6.
So yeah, are you talking of all these things?
I think it's ventricular.
Yes. Those are the ones that are making me think of hyperkalemia.
Who else thinks this is hyperkalemia?
Yeah, I think those are tall T waves. 50 waves.
So these are tall tented T waves seen in hyperkalemia. That's the most obvious thing jumping out at you.
Is that second degree heart block?
Constant prolongation, so it's getting prolonged, then it drops a bit. Second degree heart block. Yes, what's it called? What type of second?
Mobitz type 1, Weckenbach.
This is Mobitz 1. Very good. So Mobitz type 1, Weckenbach. Who did not see it?
I mean, I didn't see it before.
This is it. If you have not seen what she was describing, this is it. Longer, not all of a sudden the QRS has disappeared. It has dropped. This is what we call second degree heart block, Mobitz type 1, Weckenbach AV block. What has happened here is that the electrical signal that controls the heartbeat or that controls what's happening here, the electrical signal, it gradually slows down. So it's gradually getting slower until it doesn't produce a beat. The signal is too weak. I usually describe it as firing. It fires here, it fires here, it fires here, and it wants to fire, but it cannot fire, so it has dropped a QRS because it's not firing as it should. So it's getting slower until it can no longer fire. It drops a beat, what we call a skipped beat or a drop beat. Who doesn't understand what we've just done? If you have a question, if you're on mute and ask, please.